Hello everyone, welcome back. Today we're going to be going over oral screening. So basically how to do your own self-examinations at home so that you can make sure to be looking out for certain things, certain conditions that we'll talk about later on in this lesson. All right, thank you. So before anything, our disclaimer, thank you for participating in our research model. The purpose of this research model is to study the association between dialysis treatment and oral health. All of the information collected from the surveys will remain confidential. The program will consist of 4 virtual lesson plans and 2 surveys per lesson, one before the lesson is delivered and one after. While personal information, such as your name or address, will not be collected, the surveys may include questions regarding demographics. The surveys will be collected from a third party once completed to further ensure that your identity remains anonymous. Participation in this study model is completely volunteer, and the participant may withdraw at any time. Your completion of the survey will be considered your consent to use the information provided for our research model. Thank you.
After today's examination, you should just be able to name the most common types of skin cancer, state the occurrence of oral and oropharyngeal cancer, identify signs and symptoms of oral lesions, determine risk factors for developing cancer, list different lesions associated with dentures, describe the different steps in an oral cancer self-examination, and state important recommendations for identifying oral cancers.
So, today we're going to be reviewing some forms of skin cancer. So, basal cell carcinoma and squamous cell carcinoma. These are 2 different types of skin cancer that are very common. 85% of these skin cancers are found in your head and neck area. So that's why we're going to be going over it today, because it's a very important part of your dental visit for your dentist or your dental hygienist to look out for these signs. You also want to make sure that you're looking out for these signs that we're going to go over today at home so that we can prevent them from getting worse to the point where they can become fatal. All right, so threatening to your life. So we want to get them at the very early stage when they're not threatening, okay? And they can be treated. So basal cell carcinoma, we have a picture here of it. And then we have squamous cell carcinoma. You can see that they look very different. All right, we're going to go over signs of detecting these type of cancerous like ulcers that that you may find. Melanoma, that is another type of skin cancer. It's less common than the first 2 that we talked about, but it can become, it's more fatal, all right? So it can become something known as oral malignant melanoma. The word malignant means that it's cancerous, all right? So once it becomes oral malignant melanoma, it becomes more fatal, so more threatening to your life. And that one is down here, melanoma. As you can see, it looks more like a mole. It can be very confused. It can be confused very often with a mole. So that's why we're going to talk about these things today. All right, let's continue. All right, so whereas skin cancers are on the outside of your face, in your neck area, even on the outside of your lips, there are also oral and pharyngeal cancers, all right? Oral means mouth, so once it's inside of your mouth, inside your lips, on your tongue. Pharyngeal, oropharyngeal, that word means your throat, so in your throat area. So anywhere the inside of your mouth, your lips, your roof of your mouth, the bottom of your mouth, your throat. These are all oral and oropharyngeal cancers. More than 75% of the head and neck cancers are found in your mouth and in your throat area. All right, so that's a big chunk. That's why we're going over these today. All of these types of cancers are usually detected very late in stage. Once it's very hard to do anything about them, and once they basically become life-threatening. That's why it's so important to do regular checkups, both at home by yourself and going to the doctor and going to the dentist regularly so that we can detect these for you. All right, so here are two examples. Here's one on the side of the tongue, and here is one on the cheek, the inside. All right, so these are both oral. If there was one towards the back of the mouth, like in your throat area, that would be an oral pharyngeal one. So that's the throat. All right, thank you. Let's continue. All right, so let's go over what are some important signs, all right, that can basically be hinting towards cancer when you see something that's kind of funky on your face or in your mouth. A lot of the times we tend to have like ulcers from biting ourselves. You accidentally were eating something and you bit yourself. That's normal to get an ulcer, but these are the signs that are going to help you basically differentiate or basically be able to tell between a regular cut or ulcer and something that can be more cancerous. All right, so the first thing, if it hasn't healed in more than 2 weeks. All right, usually when you bite yourself, you might have a little bit of tenderness, a little ulcer, but it will go away within 2 weeks. If it hasn't healed in over 2 weeks, that's something that needs to get checked. If the layer of the skin on that little ulcer starts to get thinner and thinner, a red patch that is smooth and velvety, so like a red shiny patch, a red and white patch if there's like a mixture of the colors, or a white patch that can't be wiped off. All right, so we've talked about before, and we're going to talk later on in the lesson about fungal infections in the mouth. That's also going to look like a white patch, but that can be rubbed off. If it looks like just like a pale white patch and it can be rubbed off, that's something that should be looked at. An irregular texture, so if it's like a bump, if it's bumpy, if for example a mole is nice and round, but if it has like irregular edges, it doesn't look like a round shape. If it's stiff or non-mobile, all right, when compared to the rest of the surrounding skin. So if you have a little lump that basically it's very stiff, it won't really move, it's very hard, that's something that should be looked at. If it's firm or hard, once again, or enlarged lymph nodes. So when we get sick, we all have like these, they're called lymph nodes. They kind of feel like little grapes, maybe on your throat area that might get a little swollen. That's normal. If you're sick for a little while and they get a little enlarged, you feel like little grapes under your skin, that's normal. But if they've been there for more than 2 weeks, if they're hard and they won't really move, that's not normal. So that's something that needs to get looked at, okay? So once again, the biggest signs, if it's been more than 2 weeks, if it's something like a lump or something that is very hard and won't move, if it's very irregular texture, all right, and then the colors, look out for red and white colors that can't be rubbed off. All right, so let's continue. All right, so next we're going to talk about risk factors. Basically what risk factors are, these are just things about you and your life that may mean that you have a higher chance of getting any of these cancers. All right, so with skin cancers, if you're frequently unprotected under the sun, so if you're a lot outside and you're not wearing sunblock, that's a risk factor. All right, a lot of these skin cancers come from a lot of exposure to the sun without protection, or if you have a family history of these. So if someone in your family, your mother, your grandmother, your grandfather has had skin cancer or oral cancer before, that's something that's going to put you at a higher chance of getting it. Oral and oral pharyngeal cancer, the risk factors for these, basically they are twice as common in men than women. So they're more common in men than women. All right. For every one woman that gets it, 2 men will get it. That's a big difference. Age. So the average diagnosis of these mouth cancers are 62 years of age. So if you're 62 years of age or older, you have a higher chance of getting oral cancer or skin cancer. Alcohol consumption. If you're consuming alcohol, that's something that's frequently or very often touching your mouth. So that alcohol will put you at a higher risk for getting that mouth cancer. Tobacco use. So that constant smoke, the chemicals in the tobacco and the heat from the tobacco that's constantly burning inside of your mouth, that will put it at higher risk for getting oral cancer. HPV infections. So an HPV infection is basically something that you get, it's sexually transmitted. So an HPV infection will put you at a higher risk for getting oral cancer. And also, as we said, for skin cancer, unprotected sun exposure. This is something that is a risk factor for both skin and oral cancer. So really just making sure to protect yourself when you go outside, when you're going to be outside for a long time, putting that sunblock on. It's very important.
Now we're going to talk about conditions that you might see for those of you with partial or full dentures, removable dentures. So with dentures, you can have an array of different lesions ranging from a traumatic lesion, and we're going to get into all of these in the next few slides, but different traumatic lesions, oral candidiasis, which is basically a fungal infection, angular cheilitis, and papillary hyperplasia. I know that these are really big words, but we'll break it down for you. First up is traumatic lesions. So basically we're talking about trauma, and this is, blunt trauma. So your dentures are hitting against your gums. This is mainly caused by ill-fitting dentures. So when you put them in, if they're too high or if they're large in areas and they're rubbing and causing friction in different places, these can cause issues. And the first issue you usually get is ulceration. So as you can see on the left side over here, this person has some ulceration up in their gum area, right at the top, and that's usually where the top of the denture's border is going to be, right up there in the top of the gums. And you can see it's symptoms, it's kind of like yellow, white, pussy area. You can see up there it has a red halo looking area. It's usually going to be tender and painful. It makes it very difficult, and a lot of people don't want to wear their dentures due to this ulceration. And this is usually caused by that rubbing, that friction that you'll get from your denture not fitting, but it can also be caused by irritation for chemical reasons. So a lot of people use denture adhesives to keep those dentures fixed to their mouth, and sometimes you might have an allergic reaction to those adhesives. A lot of people also use different types of denture cleaners, and you may be allergic to those and you may have symptoms. Other traumatic lesions could just be caused by the friction. So down here on the lower left, you can see this is a friction lesion. There is a huge word for this, but basically it just looks like a big lump of flesh where your body reacts differently to that rubbing. So instead of getting an ulceration, which is almost like a concave area, you're going to get a convex, where it's going to grow, and this lump of growth or flesh is going to become firm, and it's basically just trying to help your body. It's like your immune system. Your body is trying to help protect itself from that harm. So if it's a constant rubbing, your body is growing an area to act as a cushion. But these are usually not tender. They're not painful. They may be white, but it most of the time just looks like a big lump or a big growth of extra flesh. Fungal infections. These are very common with dentures, and a lot of times you're going to see these with people that don't remove their dentures on a regular basis. As we had talked about in the last lesson plans, you need to be removing your dentures every night, cleaning them
and, you know, in order for you to use them during the day. And like I said, this can also be caused by not cleaning them. If you're still taking them out and then putting them back in, but they're not clean, you still have that bacteria that can cause issues to your skin. So daily cleaning, daily removal of your dentures can help prevent this. You can see by this picture, typical signs that you're going to see are a redness, a shiny velvety appearance, and burning. This is going to be very uncomfortable, almost like exposed skin. Factors that can cause this, systemic or, you know, full body factors that could also cause this, not just by the non-denture cleaning and non-removal, are diabetes, if you have a low immune system, or if you're orally taking antibiotics. These can increase your risk of developing a fungal infection. Angular cheilitis. This is just a big word for cracks on the sides of your mouth, exactly where your upper lip and your bottom lip meet. You do not have to have dentures to have this. A lot of people without dentures have this. This can be caused by a vitamin deficiency, or it can also be caused by what we call saliva pooling on the side of your mouth. So if you have dentures, let's say that you have a full upper denture and you don't have any teeth at the top. When you're not wearing those dentures, your mouth, your top mouth, collapses over your bottom lip. So you almost have this fold right here at the corners of your mouth. That area traps saliva. So that's where we talk about saliva pooling. It traps saliva right there, and it's almost like a constant wet area. So that can trap other things like bacteria and fungus. Fungal infections. So angular cheilitis is another variation of fungal infection, but because it's very common, we wanted to set it apart from just, you know, everything else. But for people that have extra saliva that don't have dentures, a lot of times they still get that pooling. You don't really have to have an overlap, but you can still have the pooling of saliva on the sides of your mouth. And just like the other fungal infection, you know, you're going to have some irritation. It's almost going to look like cracking on the sides of your mouth, almost like you have chapped lips. But it's going to be red and painful and encrusted. So you might have like a yellow crusting on the sides, but it is very uncomfortable. Papillary hyperplasia, another big word. This is a lesion created by both dental trauma and also a fungal infection. So both contribute equally. This is a lesion that's going to present as clusters of red bumps on the roof of your mouth. It's usually not painful, but it can be uncomfortable, and it also prevents you from wearing your dentures correctly because this prevents it from having a tight seal on there. So how can you detect this stuff on a regular basis, just to see, now that we have shown you what is irregular, what are common signs and symptoms that you might see and what you should be on the lookout for. Now, what is your job to do at home? We want to explain to you what a self-examination is. Just like you would do your regular breast exam, you should do a regular oral cancer screening, or even an exam to see if anything is going on with your dentures. And this is very easy. It only takes a couple minutes and you'll see exactly what you need to see. For the self-examination, I just want to show you guys what you would usually do. I'm not in front of a mirror or anything, but usually you would be in front of a mirror. You should also go to Dollar Tree, or you can go to your regular pharmacy, Walmart, anything like that, and pick up one of those easy dental kits. Usually they come with a tongue scraper, a mirror, something that you can look inside your mouth. Go ahead and pick one of those up because you're going to want to use the dental mirror that comes in the kit. The first thing that you want to do with a self-examination is look. So you're going to be in front of a mirror. If you have a little portable flashlight, that is perfect. And you just want to have really good lighting. So when you're in front of the mirror, you want to first just look with your eyes. So you're looking at the sides of your mouth, you're looking at the tongue. You want to put the tip of your tongue to the roof of your mouth and look underneath like this. Okay? And you want to Stretch out your lips like that, top and bottom. And you're just looking. You just want to look for anything before you start touching, right? And you're also going to take your mirror that you get in your kit, and you're going to look at the roof of your mouth. So you're just going to point it in there, look at that, and you can use that to look at spaces that you're not going to be able to look to. So with your mirror, you're going to also, you're looking at the roof of your mouth, and you're also going to look at your tongue. So the best scenario for a self-examination is to have a system, especially if you're doing this on a regular basis. You want to have a system so you're not missing any areas. So like I said, you usually want to start with just looking. Then you're going to take your mirror, you're going to look at the top of your mouth, and then you're going to take your tongue, just hold it in between your two fingers, the index and your thumb, and you're going to pull it out as far as you can. Take your mirror and look at the sides of your tongue, because that is the main area where you're going to see that oral cancer. That is a huge area, as well as the back of the throat. So take your tongue, and look at the sides, and then you're also going to look at the bottom and the back. So like I said before, put the tip of your tongue to the roof of your mouth, look at the bottom of your tongue, look at the floor of your mouth, and then you're going to take your mirror and you're going to do that thing that they do at every doctor's office, and you're going to go ah, stick your tongue out, go ah, and look at the back of your throat. You're going to see your tonsils. Everything should look normal, what you're looking for. If it's abnormal, those conditions that we had said before, but also it shouldn't be red and inflamed. It should just look, like a nice pink color. And if you're doing your examination on a regular basis, you'll start to know what normal looks like for you, okay? After that, then we're going to start feeling around for any lumps or bumps. So in your head and neck area, you have lymph nodes, which are basically a drainage system. So if you have any infection, if you're not feeling well that day, or if you had any past infection, your lymph nodes may be a little bit large. And that's okay as long as the lymph nodes are movable. Like if they're fixed to an area, if you can't move them, and you'll know what I'm talking about if you feel it. But if it's fixed and it's hard, then that's when you should be concerned. But most of the time you can feel them even if they're large. It's okay as long as they're moving and they're soft, okay? And you have them all in this area, all along your neck. So next stage for the examination is we're feeling around, okay? So first you're going to start with your lips, and you're going to take your index finger and your pointer finger and just feel around. You're pinching in between. Okay? Lumps or bumps. You might feel some salivary glands and stuff in there. That's fine as long as you're really feeling for hard clumps, lumps or tender areas. If you have tenderness, again, that's fine as long as it's, we have that boundary of about 2 weeks. If you see something, you feel something, and it goes away, resolves in 2 weeks, it's not as big of a concern. But if it stays there for longer than 2 weeks without healing, that's when you should be concerned. So we did lips, and then we're going to do the cheeks. So you're taking your pointer finger and pressing your 3 fingers against your side, and you're just pushing. Okay, and you're going to do it on the other side as well. Okay, and feeling for any lumps or bumps. You're going to take your fingers, your non-wet fingers, and push up against the base of your chin, and you're going to push down on the inside, right in here, and you're feeling for, again, anything that's really firm. You're going to feel lumps in there because that's where your salivary glands are, but you want to feel for any hard lumps. So push against here. And I'm just feeling down there, okay? Now that we have checked those areas, you want to pull your tongue out and feel all along the border in the center of your tongue. And that is pretty much the palpation portion, or the, the feeling around for any of those. Next, so that was the outside, or I'm sorry, the inside of your mouth. You can also just feel around here. And this is where you would be feeling for lymph nodes. And you can feel underneath the angle of your mouth. And then you can also feel underneath your chin. So taking 2 fingers down here, your thumb up here, and just pushing. And like I said before, you might feel like these bumps as long as they're freely moving, okay? And then you're also going to push against the side of your mouth. And this right here is where one of your biggest glands, your salivary glands, are. And if it is enlarged, that can be a whole nother issue. That way we want to see if you have any infection in your salivary glands. So there's a really big one on the sides here on either side, and you just push and push. Okay? And lastly, you can even inspect your neck if you want to, but we're really, looking in that area. And this is, again, where you would see more lymph nodes. But you can just roll. So you're pinching this muscle, this big muscle right here, all the way up to the back of your ear, right? So you're rolling, 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 and you're trying to feel something right on the inside here. And you can do it on either side, rolling, rolling. And then on the backs, you're just going to feel on the back of that muscle on either side. You're going to be looking right here is where your thyroid is, right here. If that is enlarged, then you could have some kind of thyroid issue. So that is another big thing that we look at. When you swallow, it should look normal. We're looking for an enlarged circle right here when we're looking at the thyroid. And then lastly, we're also looking at, this is your clavicle bone right here. It's going to be on either side. That's basically where it meets your shoulders. It's right here where your sternum is and goes up to your shoulders. So you're just going to take your 2 fingers and you're just going to push and push and push. And see, I went from outside to inside, but it does not matter. And on this side, I'm going inside to outside and pushing. And you can do either way. Okay. That is the self-examination. They have amazing videos on YouTube if you have any more questions. But yes. The most important recommendation we have for you guys is regular checkups by your physician. You want to make sure you're going to your doctor at least, you should have at least one regular doctor, and you should be going to them at least once a year for a regular checkup. Next, you should definitely be going for regular dental visits as well. And usually that's usually about 2 times a year, unless you have, a periodontal disease, which is what we talked about in a previous lesson plan. But at least as long as you're getting checked out once a year, because believe it or not, because we are in your mouth, we are usually the ones that see the signs first. So if you have oral cancer, most likely the dentist is going to diagnose it, unless you have issues that you go to the emergency room for. Cancerous lesions that we talked about earlier in this lesson are going to be confirmed by biopsy. So that basically means they would cut the area out and send it to a lab so that they could test it. And I know that sounds scary, but that is the main way that they test for any type of cancer. Early detection is key, so that's why we say get your regular checkups. If you have a concern, bring that up with your doctor. A lot of times, they're going through the whole motion, and you are your best advocate. You need to tell them if you think that there's something wrong. And not only with your doctor, but your dentist as well, or your hygienist. If you have any concerns, you're worried about something, bring it up with them, and they will be able to tell you what your next step is. Thank you guys so much for participating. I know this was a long process, but we hope that you learned something from us. Remember that after this, you have your final post-exam test or survey that we just want to get your feedback. If you have any extra feedback, remember you can leave that in the additional comment section of the paper. And we hope that you enjoyed our lessons. I hope you have a great day.